Okay, let's continue to talk about the health implications of racism. And we know, as we see from this slide, there are many different kinds of racism, whether it's personal racism, institutional or structural racism, or interpersonal racism. But experiencing racism and discrimination can increase the stress in anybody. Being disrespected or experience any kind of racism or discrimination. And sometimes we know stress have nothing to do with race, racism, or discrimination or stereotype or prejudice. Poverty can also increase a person's stress. Denigration and hostility is the same. They have the same effects on our health, essentially. All these increase our stress level, increase the level of our cortisol. And these can elevate the inflammatory response. And people can find that out through the blood test these days. And these can lead to premature cellular aging. It can affect the functionings of the heart, arteries, and endocrine system, and so on and so forth. And this ultimately increase the person's risk for different kinds of chronic illnesses. So because of that, it is important to be nice to one another. It's a no-brainer. And facing racism or discrimination, or just experiencing any kinds of stress, any of these stress, or some sources of stress are not listed in here. These can affect how the blood and sugar flow in our system. We know that. And this can affect the functioning of our stress hormones. And this can increase the level of cortisol in the person. And this in turn increase the person's heart rate when this happens, when blood flow and sugar flow are messed up. This can increase the person's heart rate or enlarge the person's heart. And this can also increase the person's risk for hypertension. So, experiencing any source of stress, including racism, stereotype, and discrimination, can also do this to our physical system. When the blood and sugar flow are messed up, and when the stress hormones malfunction, or when the cortisol level increase, this can increase our risk for cardiovascular disease and also increase our risk for hypertension. And everybody knows that when somebody is stressed, the person's level of cortisol can increase. And this can increase angiotensin too. This can also increase the vascular response to norepinephrine. And this can also increase renal sodium retention. This in turn increase the person's risk for hypertension, peptic ulcer, and glucose intolerance when somebody is stressed. And racism and discrimination can be two sources of stress. And when the cortisol is increased, this can lead to enlarged supraclavicular fat pads. This can increase the person's risk for osteoporosis, hypertension. This can also lead to muscle wasting in the extremities. And this can also lead to poor wound healing, just because the person experiences increased levels of cortisol. And this can also increase the risk for amenorrhea for women. We are talking about biological sex, not gender in this case. And these can lead to abdominal striae. These can increase the person's risk of being obese and overweight. These can also lead to cardiac hypertrophy, and the person may also have dark facial hair, especially for women. And this can change the person's face. The person may have moon face. So these came from all these sources, and I acknowledge them.